So as we say that there is a autosomal dominant and autosomal recessive disease. So why it's occur? The genetic disorder consists of three types, that is autosomal dominant, autosomal recessive, that is autosomal disease, X-linked or sex-linked, that is X-linked recessive and X-linked dominant, and another one is mitochondrial. So let's see what happened in autosomal dominant. The trait or condition is expressed in heterozygous individual, male and female affected in equal number. Vertical pedigree pattern does not skip the generation. That means your father, you and your next generation both have the disease, both have carry the disease. Okay. Unaffected individual cannot transmit the disease, show variable expressivity like both in terms of severity of the condition, age of onset. Affected individual have 1 in 2 of their offspring being affected. There is a paternal age effect with respect to the incidence of new mutation. Example include osteosclerosis, von Willebrand disease, familial hypercholesterolemia, Huntington disease, Tuberous sclerosis, myotonic dystrophy, neurofibromatosis, hereditary spherocytosis, and familial polyposis coli. Let me make it more easier. Suppose your father, like your father is the main person of your family. He earned and he did everything for your body. So he did everything and everyone have to follow his instruction. So he is dominant in your family. Suppose that is your father and that is your mother. So your father is dominant here. Okay, your father is dominant here and he is diseased. So in autosomal variant, that is dominant, male and female. So suppose you are 4 siblings, you have 4 siblings, that you have 2 sister and 2 daughter, 2 brother, right? You are 2 brother and 2 sister, or the parents, father have 2 daughter and 2 son. So male and female equally affected. That means in 4 person, male and female equally affected, and each and every generation have this trait. Okay, each and every generation have this trait. So that is autosomal dominant. This is autosomal dominant. Father is dominant here, or else mother can be dominant here. Each and every or equally, each and every next generation, the daughter and son is equally affected, and it's each and every generation have this trait, that is autosomal dominant, right, my dear? In autosomal recessive, one parents can have the trait or they both are carrier, they both can be carrier. Not every generation have this disease. There is a skip of generation. Male and female affected equally. Remember, in autosomal disease, male and female always equally affected. Horizontal pedigree pattern. That means every generation doesn't have this trait. Like generation skip. Okay, they are not carrier, neither carrier or nor affected. So there is a generation skip present in autosomal recessive. So see what is written in your lecture. The trait and condition is only expressed in homozygous individual. Male and female are affected equally. Horizontal pedigree pattern, both male and female can transmit the trait to their male and female offspring. If both parents are carrier, 1 in 4 offspring will have this disease, 1 in 4 in normal, and 1 in 2 will normal carriers. The offspring of an affected individual must either have the disease or be carriers, or there is no normal allele. The variable expressivity are feature of autosomal dominant inheritance. There are increased risks of autosomal recessive condition in the offspring of consanguineous marriage. Example include cystic fibrosis, sickle cell disease, phenylketonuria, adrenal syndrome, mucopolysaccharidosis, spinal muscular dystrophy. In autosomal recessive, we see there is male and female both equally affected, but in autosomal recessive, two will be normal if they have four child, one in disease, one in carrier, and others two is normal. That is normal 50%, 25% carrier, and 25% disease. So this is important for you. Why? Questions, how come? That is, the question is come as a theoretical question, as I say you, if example is coming here, or else this is pedigree. You have to diagnose either it is autosomal recessive or it is autosomal dominant or X-linked recessive or X-linked dominant. This is autosomal recessive. See, the one of family is carrier or affected. Suppose the father is carrier and mother is normal. So see, there is a age and every there is a generation skip, right? There is a generation skip. Second generation disease and carrier. Third generation no disease, and fourth generation has 25% is carrier. That is 25% is carrier, 25% disease, and rest of all, that is 50% is normal. So this is autosomal recessive. If it is autosomal dominant, father is disease, every generation has carried the trait, male and female equally affected. That is the pedigree of autosomal dominant. Now, we are going to discuss about the X-linked recessive disease. That is, inheritance is 1:2. Inheritance is 1:2% son of the carrier female, male, and are affected predominantly. In X-linked recessive disease, male are affected predominantly. Male-female transmission never occur. Unaffected males never transmit the condition. Affected male transmit to the allele to their daughter, who become heterozygous carriers and are almost always unaffected. Night move pedigree pattern. The severity, night move, circle the word night move. Night move pedigree pattern, the severity of the disease is uniform across the generation. All women with an affected son and affected brother is an obligate carrier. Example include red-green color blindness, Duchenne-Becker or muscular dystrophy, hemophilia A, B, and X-linked aganglionogenesis. Females can be affected by X-linked recessive condition due to atypical ionization. The atypical ionization random ineffective of the normal X chromosome, X autosome, translocation under which circumstances the normal X chromosome is preferentially inactive, Turner syndrome, a new mutation on the second X chromosome. However, the X-linked dominant disease inheritance is 1:2 offspring of affected female, often manifest a very severity in male, frequently leading to a spontaneous loss of neonatal death. Of affected male pregnancies, including incontinence pigmentia, Rett syndrome, and vitamin D resistance rickets. Now, another important thing is mitochondrial pedigree also come from here, and you have to know the example of mitochondrial disease. Mitochondrial means mother related. See, mom to mitochondrial, mother to mitochondrial. This is also a material line because sperm do not contribute to the zygote beyond their nuclear DNA. The mitochondrial inheritance condition can affect both sex but is only passes on affected mother, including Leber's hereditary optic neuropathy, Leigh syndrome, diabetic. Write down the note in the example, including Leber's hereditary optic neuropathy, number 1, Leigh syndrome, number 2, number 3, diabetes insipidus, number 4, diabetes mellitus, number 5, optic atrophy, number 6, deafness. Write down please. Diabetes insipidus, number 3, diabetes mellitus, number 4, optic neuropathy, number 5, number 6 is deafness. Okay. So this is all about mitochondrial. So as we discuss about the mitochondrial disease, this is all about maternal. If your mom had this criteria or this trait, each and every siblings of your family have this disease and have this trait. So this is very much important thing, and questions came from here as example and as pedigree. So as an example, I told you that this Leber's hereditary optic neuropathy, Leigh syndrome, diabetes insipidus, diabetes mellitus, optic neuropathy, and deafness. How pedigree comes? So I'm draw a pedigree for you, my dear. That is a pedigree of mitochondrial condition. Okay. So this is the affected mom or mom having this disease. Marry with a normal person. After that, she had 3 daughters and 1 son, and everyone has the trait of mitochondrial disease. The affected daughter marry with a normal person, and in her family there is 2 daughters and 1 son. Each and everyone have this disease too. So mitochondrial disorder is like a dominant disorder, which is maternal dominant or mom dominant, and every children of the diseased mom has passing the trait to her each and every son and daughter. Now we have to read some example of genetic disorder, right? So let's have a look on your lecture. First one is tuberculosclerosis. You have to know this is autosomal dominant or autosomal recessive. So yes, my dear doctor, this is autosomal dominant disease and is a rare multi-system genetic disease that causes tumors to grow in the brain and other vital organs. This is very much important. Circle it. The rare multi-system genetic disease that causes tumor to grow in the brain and multi-organ. And which gene is involved here? Mark the circle the word, that is TSC1 gene, that is tubercular sclerosis gene 1, that located on chromosome 9. Circle it, chromosome 9. TSC2 gene located on chromosome 16, that is TSC1 gene located chromosome 9. 1 gene, 9 chromosome, 2 gene, 16 chromosome. Okay, circle it. Feature is learning difficulties, epilepsy, cardiac rhabdomyomas, renal angiomas, skin manifestation, and some brain abnormalities, that is cortical tumors. That's it. So you have to remember tubercular sclerosis is an autosomal dominant disease and the gene involved it. The gene is TSC1 gene that is located in chromosome 9 and TSC2 gene that is located in chromosome 16. Next, cystic fibrosis. Yes, my dear doctors, this is autosomal recessive disease. Very good. It is autosomal recessive and the gene is CFTR. It causes by mutation of CFTR gene. So circle the word CFTR gene. The cystic fibrosis is caused due to mutation of CFTR gene. Prevalence is 1:2000 and carrier rate is Caucasian, that is 1:23. CFTR gene is located in chromosome 7. Very much important line. Circle it with red pen and give it 5 star. The gene is located in chromosome 7. Remember, CFTR gene mutation occur and the chromosome is 7. Produce the chloride iron protein which is responsible for anion transport, and there are over 1400 multiscat can affect the CFTR gene. The most important feature of CFTR gene or cystic fibrosis is infertility. Mark the word infertility, pancreatitis, cirrhosis and intestinal obstruction, malabsorption, osteoporosis and diabetes. The infertility is due to what? The infertility is due to congenital abscess of vas deferens in case of male and thickened cervical mucus in female. Very, very important. Mark it 5-star. Question on and off come from here. Why infertility occur in cystic fibrosis? The answer is in case of male, there is an absence of vas deferens, and in case of female, there is a mucus thickening. Okay. Now we are like to discuss about the sickle cell disease. Is also caused by a point mutation of beta globin chain if hemoglobin. The hemoglobin chain, that is a beta hemoglobin, is responsible for sickle cell disease. Mark the word beta cell or beta globin chain of hemoglobin. Is due to a single base change is substitute with thiamine causing glutamic acid to be replaced by valine. Glutamic acid is hydrophilic and valine is hydrophobic. Mark this: glutamine hydrophilic, valine hydrophobic. Circle it. Prevalence in London, very much important. Circle it: 1:500 prevalence in case of London. There is a two type, homozygous and heterozygous. Homozygous is hemoglobin SS and heterozygous is hemoglobin AS. Aplastic crisis triggered by parvovirus B19. Circle it with red pen and mark it 5-star. This is a very important question. This question is came from MRCOG Part-1 on 2015, I guess. So aplastic crisis is triggered by parvovirus. Mark it. Blood film shows sickling of RBC and may shows the feature of hyposplenism, that is Grossite and Howell-Jolly bodies. Treatment: cyanide, penicillin, vaccine for encapsulated organ. Which vaccine we like to give in sickle cell disease? There are 3 vaccines: Haemophilus influenza, Streptococcus pneumoniae and Neisseria meningitis. This vaccine we give for sickle cell crisis. Haemophilus influenza, say with me. Haemophilus influenza, Neisseria meningitis and Streptococcus pneumoniae. Now, I like to discuss a little bit about thalassemia. To see a complication of sickle cell disease, not necessary. Give it 1-star and rapid read for this sickle cell disease complications, but it is not necessary. It's less important. So thalassemia is an important thing. Another, the prevalence in where. So questions is come from the prevalence of thalassemia where. The prevalence is Mediterranean, Arab and Maldives. Mark it: Mediterranean, Arabs and Maldives. There is a 6 type of thalassemia. You have to know the types and the chain affected. Which chain is affected in which type. So alpha thalassemia, production of alpha chain affected. Beta thalassemia, production of beta chain affected. Delta, production of delta chain affected. E thalassemia is similar to beta thalassemia. S thalassemia is similar to sickle cell anemia. And C thalassemia. These all about the thalassemia types. Prevalence, I told you, say with me again: Mediterranean, Arab and Maldives. Circle the word Maldives. RBC morphologically abnormalities on blood film, that is blood film found in thalassemia. So you have to know the blood film we found in thalassemia. The RBC is anisocytosis, poikilocytosis, microcytosis and hyperchromic. So we know that anisocytosis means RBCs are unequal in size. The unequal size of RBC means anisocytosis. Poikilocytosis means abnormal shape of RBC. We found randomly abnormal shape of RBC in thalassemia. Microcytosis means smallest size and hyperchromatosia means pale RBC. So in thalassemia, the RBC or the blood film, we find out that there is a abnormal shape of RBC, unequal shape, unequal size and shape of the RBC, pale RBC and smallest RBC we find it out in thalassemia blood picture. Also, we find out target cell basophilic stripling and fragmented RBC. My dear doctor, you have to know the type and the abnormal chain affected in thalassemia, that is A, B, C, D, E, delta, alpha, beta, delta and SEC. And we also know, remember the prevalence in thalassemia, that is Maldiv, important, very important thing, Maldiv is prevalent, and RBC morphological slide found. So blood film including anisocytosis, poikilocytosis, hyperchromatosia and microcytosis. Also we find out target cell basophilic stripling and fragmented RBC. Now in UK prevalence is thalassemia is 1:10,000. Mark the circle the word UK prevalence 1:10,000. Has 3 classification, that is thalassemia major, thalassemia minor and thalassemia intermediate. So circle the word major due to homozygous for beta thalassemia gene, minor genetically heterozygous and intermediate genetically heterozygous. There is a clinical feature of thalassemia we have to know, because there is a clinical questions come from the thalassemia, like clinical feature include fatigue, anemia, jaundice, shortness of breath, skeletal deformities due to increased erythropoiesis, hypersplenomegaly, hypochromatosis, and delayed physical and sexual development due to hemochromatosis. Suppose a question came to you, a rapid question, that a patient comes to you with complaint of tiredness and fatigue and shortness of breath. After doing her blood picture, you see there is a target cell and there is RBCs, anisocytosis RBC and the microcytosis RBC present here, and there is a family history of thalassemia. So which is your diagnosis? So probably this is thalassemia, right? So suppose this type of questions is come in a clinical question as a thalassemia. So you have to remember and you have to know the clinical features of thalassemia. So there is a little bit you have to know about non-disjunction. Is give it 1 star. That is failure of the chromosomal bivalent of segregate to the 2 daughter cells during the anaphase can occur during meiosis 1 and meiosis 2 or during mitosis. Circle the word meiosis 1, meiosis 2. Non-disjunction occur at meiosis 1, meiosis 2 or mitosis. Occur during meiosis 1, the gamete receive both homologous and chromosomal pair. Occurring during meiosis 2, the gametes receive 2 copies of 1 or 2 homologous of the chromosomal pair. Reciprocal translocation is a result from the breakage of at least 2 metacentric chromosomes. What is the metacentric? That is, the centromere lies in the middle, that is metacentric, right? So metacentric chromosomes, that is chromosome 1, 2, 3, chromosome 19, 20, these chromosomes are metacentric chromosomes. Long arm chromosome 11 and 22 more commonly involved. Circle the chromosome 11 and chromosome 22. Very much important thing, right? Mark it with red pen. That is chromosome 11 and chromosome 22 are more commonly involved. The total number of chromosomes maintained at 46. Risk of abnormal offspring dependent on the particular chromosomal rearrangement, but lies between 1 to 10% mark is. Robertsonian translocation. Which chromosome is involved here? That is acrocentric chromosome. Robertsonian translocation is always breakage of 2 acrocentric chromosomes. Which one is acrocentric chromosome? The centromere in lies the end of or the near the satellite or near the one end of the chromosome, that is acrocentric chromosome. I hope you can remember this. The one end, when the centromere is lies or attached to near the one end of the chromosome, that is acrocentric chromosome. So which one are the acrocentric chromosome? Let's recap. That is 13, 14, 15, 21, 22 and Y. these chromosomes are acrocentric chromosomes. So from the breakage of two acrocentric chromosomes at or close to the centromere with fusion of long arm, loss of the short arm. Total number of chromosomes reduced 45. Short arm usually contain only ribosomal RNA gene. Incidence 1:1000. Circle 1:1000. 13q, 14q translocation is most common, and increased risk of the miscarriage. Fetal anomaly is carriers of balanced Robertsonian translocation. Now, please note down some example of translocation disease. I repeat, translocation disease. Note down it. Number 1, carcinoma. Number 2, infertility. Number 3, Down syndrome. Number 4, XX male. These all are translocation disease. I repeat, carcinoma. Example as acute myeloid leukemia, chronic myeloid leukemia. Number 2, infertility. Number 3, XX male. Number 4, Down syndrome. So you have to remember reciprocal translocation occur in metacentric chromosome. Robertsonian translocation occur mainly in acrocentric chromosome.